Chorus Voices, the podcast brought to you by Chorus, a fresh approach to community service. Settle in, listen in, and enjoy the voices who bring you reflections, musings, and stories from our community.
Hello and welcome to this episode of Chorus Voices. I am CEO Dan Minchin.
And I'm Lou Forster, Head of Brand and People here at Chorus.
We've got something a bit different today, haven't we, Lou?
We have indeed, and we've invited someone to come into the studio. And can I get you to introduce yourself?
I'm Tina Newman and I'm currently part of the action team at Chorus.
Thanks for coming into the studio, Tina. Well, why we've invited you in is because both yourself and Dan have had a great experience recently, both been on a bit of a study tour kind of trip that came about quite unusually. We'll get into that in a minute. But we wanted to explore a little bit about the trip and what you learnt and what you've taken away from it. So Dan, tell us a bit about how you ended up on this trip.
Yeah, so there's an organisation called buurtzorg, which is a Dutch organisation, and buurtzorg stands for neighbourhood care, or it's Dutch for neighbourhood care. And it's a really quite remarkable organisation that was established about 10 years ago in the field of community nursing and community care, so very much similar to what Chorus is on about. And has become somewhat famous for its very radical way of working, which is all about self-managed teams, really. So teams of about a dozen nurses based in communities where they work around Holland. And operate pretty much with no management in place, no management hierarchy. A fascinating story, and has become a bit of a case study in this sort of sector, I guess, of community organisations, and are now starting to look internationally about how it might work in other countries.
Now, Dan, you say that they're small teams, between 10 and 12, but that probably belies the size of buurtzorg. How big is it?
Yeah, so they have around about 15,000 employees now, of whom about 10,000 are nurses, community nurses, and the other 5,000 are in domestic and community type support. And that's grown from zero in 2008.
So it's not a tiny organisation with a couple of teams of 10 or 12. No,
it's a sort of part of the furniture almost in Holland, in the way that people can stay at home and either recover from an illness or live with a chronic illness, and in some cases in palliative care sort of setting towards the very end of their life.
And you got to go over there and experience a bit of life at buurtzorg, or certainly find out how they operate this organisation.
Yeah, so I was very lucky to meet the founder, Jos de Blok, and a number of members of his leadership team and some of the founding people who were there as part of this thing. And we basically had a day and a half of talking about how buurtzorg works, including some of the things that I've just been describing. And really the most striking thing for me about this organisation was just exactly how radical it was in terms of empowering individuals who come and work for buurtzorg to work as professionals very closely with the patients, as they call them, to enable those patients to continue to live at home and live the sort of life that they can. But there's this sort of overwhelming sense of energy and commitment to the work, which is just really rare. And all organisations, including Chorus, have hierarchies and systems and processes in place which do tend to take the joy out of work and tend to make things feel very bureaucratic. And what buurtzorg has discovered is a way of working which enables people to come to work and be their true self, and achieve amazing things both for the patient and also within the context of these teams.
I love the comment about joy, and I know that's one of the things, Tina, you mentioned to me when you told me about the experience you had. But before we get into the experience, tell me, or tell the listeners a little bit about how you ended up on this particular week in the Netherlands.
Look, my interest first started with a workshop I did at Corporate Rebels, and I had done some research, and then I was going on holidays to Rotterdam, and I had a ad hoc comment at the end of a working day on a Friday, and I happened to say to a colleague, "Oh, so what are you doing for the weekend?" And he said, "Oh, off to Dongra." And I said, "Oh, what, not Holland?" And he said, "So who's going to Holland?" And I said, "Oh, I'm going to Holland." And he said, "Oh, you should look up the Buurtzorg model while you're over there," which hadn't even been a thought. So I sent an email to them and said, "Look, I'm going to be in Holland. I love the work you're doing. It's a really long shot, but can I have some time with your teams?" And unbeknown to me, Dan was planning to go to Holland, and Buurtzorg Australia emailed Chorus and said, "Hey, we've had this email from one of your people named Tina Newman. Does she belong to you?" And from that...
Funny how the world works sometimes,
yes.
Isn't it?
And from that, an opportunity came up because Dan was flying back to Australia on the Thursday, and they had a shadowing with the nurses as part of the workshop on the Friday. So I was meant to leave the week before, so I wouldn't even have been there normally. So I thought the universe had started to weave its magic, in my words. And so it was organised. I flew to Rotterdam, and then by another amazing coincidence, one of my partner's colleagues based in Rotterdam's wife had started with the Buurtzorg team only 3 months before and offered to have coffee and a chat with me, which is really wonderful.
And I think in the Chorus way, you popped out a recording device and captured some of that. And I think we were lucky enough to have a bit of a listen to that conversation now.
So, Hanneke, can you tell me a bit about you and what attracted you to work with a team delivering care through this model?
It attracted me very much because you have to do everything yourself. It's the planning of patients, clients, we have to call them. The patient contacts you if you are able to deliver the care. And if you have the time, you accept them. Then you do the intake. And if you have all the information the headquarters need in Almelo, you send it there.
Is that your back office? What you call a back office?
That's the head office.
Yes.
Yeah.
So
because we only have a very small office in the village.
Yes.
I live, and then but all the financial things they take care of in Almelo.
So that is the main centre for the model.
Yeah.
Okay.
But there's only one office for the whole country.
Yeah, it's amazing, isn't it? Yeah.
And they do all the financial things with the insurance companies, and they take care of that.
Okay.
But the rest we do ourselves. They also make the connection with the insurance office.
Yes.
For the patients' house, we have a lot of different insurances, health insurances.
Oh, okay, yes.
Yeah.
So if the customer contacts you and then you have capacity to deliver that care, you then contact your head office, who then negotiate with the insurer.
Yeah.
Okay.
And then if they say, the insurance
will cover it.
Mostly says it's okay. And then we start the intake. We have a talk with the patient, and we decide what care is needed. And that's from giving the medication to the whole scala of care that has a connection with nursing.
Then you
that's
can do
for us. Yeah.
So how many in your team here?
Only 6.
Only 6?
We have a very small team. It's because, the city Delft?
Yes.
Yes. And next to it is a very small village, Den Hoorn. That's where we live.
Okay.
And our office is in Den Hoorn and a small part of Delft. Okay. And that's our region. And we also have Delft Center. Mm-hmm. They have a bigger team because they have a lot more patients.
So very nice. This morning. Can you work outside Delft or not, or are you zoned to a certain region?
We have a special zone.
So when I read about that model, they talk about the team working out, who does what around your budgets, your training, those type of things, so that you're self-managing. Is that your experience?
We have a very small team. and we decide everything together.
Yes.
Yeah, we come together, we meet every week on Monday afternoon after the morning shift. And then we check all our patients. Do we need to change something? Is there enough care? Do we have to get by, to go there more often?
Yes.
The medical supplies for the patients, we
Yes.
check if,
Okay.
if we need to order more. Some things we order in Almelo, the rest we order locally, and almost everything online.
Okay.
Yeah, only the pharmacists, but that's our neighbor from the office, so we have to go there. It's very easy.
Yeah, it's very easy.
Yeah, and we take care that patients have their own medical supplies, that there's enough if there are changes.
When I read about the model also, they talk about coaches. So not managers, but coaches. So do you have a coach for your team?
We have one coach for this part of Holland. Holland is divided in 12 provinces, they call it. And every province has its own coach.
Okay.
Yeah.
So what are they meant to do, the coaches?
It's just, it's
Problem
especially
solving?
talking, problem solving, but we didn't have a lot of problems. Other teams sometimes do have.
Yep.
But I think in our team it all goes very smoothly. And we're also, our nurses, almost all the same age, 50 plus.
Yes. It's a rich age.
But we have a lot of experience.
Yes.
Also in hospitals, in nursing homes.
Yeah, which is good, isn't it?
It's
if you
very
get
good.
into tricky situations, you
Yeah.
know what to do.
Yeah.
I read some research and they talked about coffee before care. And within this model, and I guess it resonated with me because it was a way of working with people that values people, because you listen first, and then you allow people to get a sense that they've been seen and heard and valued, and that within that you affirm that they know what's best for them. So is that how you see what you're doing in this model?
I think so. I think if I compare it to the other home care givers, the big companies,
Yes.
it's all time. You have 5 minutes for that patient. You have only 10 minutes for that. In the 10 minutes, you also have to do all your administration, and it's clocked.
Yes.
And we don't do that.
Yeah.
We go to the patient. We see what's needed. If I've scheduled 10 minutes for one patient, but I need 10 minutes more,
Then you just do it.
I take 10 minutes more. Sometimes I have to call the next patient, that will be a bit later, but it's possible. Yeah, and that's what I really like about this way of working.
So what do you really think are the benefits of the way you're working for yourself
with all
and
in
the
your own
person?
hands. Yeah, there are some rules, of course, but that's more legally.
Yes.
The care you give, you can think of that yourself, with your team. What's the best for this patient? And do we have the time? And that's what I like the most. You have time for your patients. Because in the hospital, you don't have time.
No.
But I see from the other organizations, not a lot of time.
Yes.
And here we have. And that's what I really like.
So I'm so pleased, Tina, that you had the opportunity to have this conversation with Henneke. I'm really interested in your thoughts on the differences between nursing in Australia and nursing, particularly in the Buurtzorg model in Netherlands.
My experience is from quite a few years ago, but what I really loved, Lou, was the simplicity of the model. So the patients can contact the nurses, and there seems to be a very simple referral process with no referral form. The nurses can go and visit the patient in their home, and it is that coffee first and care where they work with the patient in a person-centred way to look at what their needs are and what's important to them and set goals. And the system works quite differently, obviously, in Holland, because once they've done that, that comes back into the Buurtzorg office, the back office, because then they work with the insurers, which is not the model in Australia that we currently have. However, the patients get 4 to 5 nurses, is what I'm told, and they rotate in roster. So in the small teams, they always have someone who can backfill, is available at short notice, who knows the patient. I was just about to say customer because that's a term we use, but the patient, and there is that continuity of care. What I also loved was it truly is person-centred care. The person is in the centre of everything, and then they move to an onion-type model where they would look at informal care.
When you say onion, are we referring to layers?
Yes.
Yes, okay.
Maybe they talk about an onion,
Yeah.
although it's a circle in the diagram that they present that I've seen. And then you would move to, so the person, the informal, and then to the Buurtzorg nurses, and then to the formal networks. And there's a really lovely little story. I went with the nurse to visit an elderly man in a high-rise building who has dementia and had lost his wife, and he had a chest infection, and the day centre had phoned her previously to say they were a bit concerned. When she attended to his personal care and she fixed his breakfast and spoke to him, he said, no, I'm fine, everything's good, I'm feeling good. She walked away and said to me, no, I'm still really concerned about him. So she would go to the family and those informal networks first to have that discussion. And if they couldn't do that, then the Buurtzorg nurses may actually take the patient to the doctor, and then if they needed to refer on, it's just simple.
It is. The simplicity is incredible. I mean, the coffee first, I love that. I totally think I
me
could
too.
work in
And they all
Buurtzorg.
say that, right? You know, coffee first, then care.
And that's so simple. And it sounds so much more conversational than, person-centric, doesn't it? It's just like everyone can understand coffee first.
And the thing that, they talk a lot about simplicity from a organisational perspective, and their whole mantra is to keep the world simple for the staff. But what that's a means to the end of creating this really human kind of experience. And I think that's what's, it's sort of crazy to think that that's a radical idea, but organisations and the kind of systems that we work in do tend to dehumanise. It tends to talk in medical terms or bureaucratic terms, and people get treated as numbers. This is the feedback that within Chorus and across the aged disability mental health systems we get all the time. And so what's so exciting, and I can hear it in your voice, Tina, is that this is a way of working which just treats people like people. And that shouldn't be a radical thing, but it actually is unusual in an organisation or in a system that we just treat people like people.
One thing that stands out to me is that it's, we talk about this down, it's often easy to say and harder to do. So, Chorus wants to enable people to live the life they choose, and we often talk about not liking service land. You talked about that before, everything being about the systems, the provider and everything. But, we say that. I guess the exciting thing for me about you going on this trip is that hopefully we can turn the talking into doing. So what does that look like from an organisational perspective, do you think?
The transformation, the change required, not just within Chorus, but within the way the system works, is enormous. The Buurtzorg model grew up in a context that was completely different to where we are now. Tina mentioned the way the insurance companies work. It's completely different to the way we work. But at the time, Jos and his colleagues were identified that the way the system was working in Holland was crappy, and that was something that they wanted to push back against. And just like all great disruptions in the history of organisations, they pushed back against the way things were done. So what we need to start with, I think, in Chorus is an appetite for pushing back against the way things are done. And that's how Chorus was started. We're going to bring this fresh approach. No one's quite sure what we mean by fresh approach, but what we do when we go around the world, and I went there on a work trip and Tina happened to be there on holiday, we come back with these little bits of inspiration that make us believe this is possible. I don't know exactly what it looks like. I'm pretty sure that the starting point is to get people involved, whether they are customers or staff or volunteers, of course, get people involved. What does it look like to make this really a place where we treat people like people? How do we simplify things? We've talked a bit before, and within Chorus we talk about the organisation becoming increasingly set up around sort of local communities or neighbourhoods, to use the Birdsong language. So rather than being a sort of military-style operation where we're sending people out into the whole of Perth, we establish a sense of place and belonging and a community within which people can work and also come to work with Chorus as a customer or a volunteer or some combination. And so it's almost like, let's put that question to people in the Chorus community and get them involved. Because one thing's for sure is you can't design a people-first type way of working from a corner office. It has to be done by those people. And I think it's a little bit about how we can make Chorus a place where people can do that. And I think over time we will discover whatever the Aussie version of, or the Chorus version of, is something like. I'm not saying we're going to replicate the Birdsong model line by line at all, because I think it's going to be contextual. It's going to be driven with some principles of simplicity and people first and relationship building and this sort of thing. So,
Tina, if you had a question from a colleague or a bunch of colleagues at Chorus that said, look, what's one or two simple things we could do that could put us on that journey, what sort of things could we take on board, do you think?
I think the concept of placing small teams in a community is absolutely really important, because that small team gets to know the culture of its community and the interconnectedness, and the way that I guess it's currently done makes that quite challenging, I would think. I think that for me, having the right people in those positions, whatever that looks like, who know their responsibilities and who know that they have autonomy to make this work within that responsibility, and that it's an exciting thing to know that you can have a role that plays to your interests, skills and passions and helps you use those and grow. The other thing I love is the coaching component of the model I saw. And one of the things that really resonated with me I think his name was Wilco, when I travelled with him and I asked him about that model, is that they have large teams to stop people managing, because there's still that.
Well, they spread the so-called manager across so many different teams that they can't possibly control it all.
Absolutely, that's what he's saying, yes.
Strategic, I like it.
Yeah, I liked it as well. And he talked about his early days when he was sailing and how his thinking around coaching came from that, because you've got to rely on each other. It's really important. You have to know what your roles and responsibilities are, because it's life and death often at sea, and how you bring that thinking to a coaching role within the Birdsong model for him. It's really interesting.
Yeah, I think that might be an idea for another podcast right there about because this coaching thing, people talk about it in organisational contexts all the time. It's actually extremely powerful, and it's because it's empowering, and it treats people like adults, and it says, well, you come into the room or into the community with whatever you bring, and we're going to get the best out of that. So maybe coaching could be another conversation. But yeah, it's in a way for me, there's a sort of going the full circle back to some very basic principles of human existence and human connection. It's sort of radical in as much as it's moving away from industrialised ways of working. But it's not radical in that it goes back to where we all began, which was, Lou and I have talked about it before, small groups of people sitting around a campfire and sharing in the experience of being alive.
Well, that has been a lovely conversation. I'm really pleased that you got the opportunity to go, Tina, and I love the planets aligning for this. It gives us some real depth just to hear from that conversation you had. I think Dan's feedback from the trip was really interesting, but that depth to hear your stories and Henneke's stories just really adds so much to it, and I'm very excited for our journey ahead.
So thank you, Tina, for taking a holiday in Holland and slipping in a little bit of a Birdsong visit and thanks for coming on the podcast.
Thanks very much for having me here today, and also to Chorus for supporting that journey with the Buurtzorg nurses. It was truly amazing.
That's been Chorus Voices for this episode.
Thanks for listening to Chorus Voices, the podcast brought to you by Chorus. If you like our show and wanted to know more, check out our website at chorus.org.au. And please leave a review. We'd love to hear your feedback, and it helps others find us and enjoy the podcast as well. Join us next time for more inspiring stories and news from our community. Chorus, a fresh approach to community service.